Welcome to another episode of Follow the Brand. I am your host, Grant McGaw, CEO of 5-Star BDM, a 5-star personal branding and business development company. I want to take you on a journey that takes another deep dive into the world of personal branding and business development using compelling personal story, business conversations, and tips to improve your personal brand. By listening to the Follow the Brand podcast series, you will be able to differentiate yourself from the competition and allow you to build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build trust, and reflect who you are. Developing your 5-star personal brand is a great way to demonstrate your skills and knowledge. If you have any questions for me or my guests, please email me at grant.mcgaugh, spelled M-C-G-A-U-G-H, at 5-star BDM, B for brand, D for development, informaticists.com. Now let's begin with our next 5-star episode on Follow the Brand. Welcome to the Follow the Brand podcast. I am your host, Grant McGaugh, CEO of 5-Star BDM, where we help you to build a 5-star brand that people will follow. In an age where work quality and digital footprints are measured more than ever, informaticists must develop and curate their own individual brands in effective ways. My next guest, Oscar Perez, uses his brand to communicate resources necessary to accomplish a strategic goal, solve tough IT challenges, and to define the costs associated with performance objectives. Perez lives at the intersection of informatics and IT technology, the integration of healthcare sciences, computer science, information science, and cognitive science. He focuses on the people and processes to manage technology and data to deliver the right outcomes at the right times to maximize patient outcomes. Oscar says informatics is about understanding workflows and the systems that you're using in a healthcare setting. Understanding and connecting the dots by being able to align clinical and business systems to the technical requirements. Mr. Oscar E. Perez is the Chief Application and Innovation Officer at Health Choice Network in South Florida. He is a transformational and innovative leader with extensive experience in a healthcare executive leadership role. He has a proven record of achievement in strategic planning and digital transformation, known for developing and building high-performing teams that enable technology throughout the entire organization. Mr. Perez is accomplished in addressing business and clinical critical issues, utilizing technology and innovative approaches while managing costs and reducing risk. Mr. Perez has been in healthcare IT for over 28 plus years. He's worked at various healthcare systems, including large academic medical centers like the University of Miami Healthcare System and large public healthcare safety net systems like Jackson Memorial in South Florida. Most recently, he was Vice President of IT at Memorial Healthcare System, a 6-hospital public healthcare system that includes Joe DiMaggio's Children's Hospital in Broward County, Florida. In addition, he's consulted at many large healthcare systems throughout the country like Emory in Atlanta, MD Anderson in Houston, and many more. His well-rounded healthcare experience has allowed him to make an impact wherever he has been. Mr. Perez currently lives with his family in South Florida, where he received a Bachelor in Management Information System from FIU and a Master's in Healthcare Business Administration from the University of Miami. He also serves on the board for South Florida HIMSS as past president and is a member of CHIME and NACHC. Let us welcome Oscar Perez to the Follow the Brand podcast, where we are building a 5-star brand that you can follow. Hello, everyone, and welcome again to the Follow the Brand podcast with your host, Grant McGaw. I'm going to stay local this week. We're going to stay local. We're going to stay right here in the Dade County area. We've got some very phenomenal people in Miami-Dade County in the health informatics world. And I'm going to go on record and say that the person that we're going to have on tonight is probably one of the most recognizable people in his field here in Miami. He's been a part of the community for a long time. He's worked at a lot of the iconic and large big box hospital systems, and he's doing some phenomenal work now for Health Choice Network. So I want to bring to the mic Mr. Oscar Perez, and we're going to have a candid conversation about himself and the things that he's doing to impact others with his skill set. So Oscar, you'd like to introduce yourself?
Yeah, Grant, thank you. Thank you so much for having me. My name is Oscar Perez, and I'm the Chief Digital and Innovation Officer at Health Choice Network. And, I've had the honor of been working there for about a year and a couple of months. And prior to that, as Grant mentioned, I've been in various healthcare systems here in South Florida, and also had the opportunity to work, do some consulting across the country. So I've been in healthcare IT. I consider myself a healthcare professional for over close to 30 years now. And, I love what I do. I have a passion for what I do. And I just want to continue to help bring, technology to healthcare and help healthcare along, which is one of my goals.
I tell you, Oscar, I looked at some of the things that in your resume, and I just looked through it and I see, wow, this guy he's local. First he started out at the U. So he's got to talk about the U. And I want to know, this is the question I want to know is like, why did you pick health informatics? Did it pick you? Were you looking into something else and this kind of fell in? Let's hear that story.
That's a great question, Grant. I was fresh out of college. I was working for UPS at the time, delivering packages door to door. And then one of my aunts worked at the University of Miami, and she told me about an opportunity to work in the Department of Anesthesiology back in the day. And, I interviewed, it was for a data entry or data analyst position. And I never looked back after that. It was something that, I found to have a passion for. And although it wasn't your typical IT department, it was within a clinical department with the University of Miami. But it was kind of doing, data and analytics work way back in 1994. And so, that's what got me hooked. And to get to see that, firsthand, to be able to see the improvements that could be done. Working in the Department of Anesthesiology was something that was special as well, because I got to work a lot in the operating rooms at Jackson and support our anesthesiologists at the time. The department was kind of ahead of its time for that era. And we had, there was actually a system, an electronic anesthetic information system at the time that they were using. And so that's where I kind of got my ears peaked and develop my true passion in life, which was really, how do I get these, health information systems? How do I get technology and use that in healthcare to help, provide better care, provide better processes, really help healthcare advance. And so that's kind of where I started was in the Department of Anesthesiology, University of Miami, 1994. And that's where I met one of my very first mentors. And I think that's an important thing that we should talk about is, in this life and in this career, it's important to have, mentors that you either look up to, learn from, learn what to do, learn what not to do. And I was fortunate enough to meet one of my mentors early in life, which well, Elizabeth Rockwitz.
Oh, yeah.
I'd like to give her props. She's one of my first mentors in life, but she really took me under her wing and really counseled me and showed me the ways and things that could get done and not done. And I really owe a lot to her. So
you've got to get those advocates. Elizabeth, wow. Now we'll talk about our HIMSS relationship here a little bit later, because it's a lot of wonderful people that brings us together. Like it's family, right?
Yeah.
Liz has definitely been very influential. But I want to talk, because you got into, and there's a difference. Now, I've been in information technology for 20, 25 years.
Help us understand, our listeners understand, what is informatics and what is information technology. How would you describe those two things?
That's a phenomenal question. One that I've asked many organizations and departments about. Um, I think in healthcare, we love acronyms. We love using different terms for a lot of things. And if I had to put it simply, I think that it's all under the umbrella of information technology. However, I think historically what's happened is, information technology has become sort of the technology side of the house. So the hardware, the network infrastructure, the security, the techie stuff. And then the informatics stuff kind of falls more on the IS side, or the information system side of the house, where, informatics is really about understanding workflows and translating those workflows into configurations of your systems that you're using. And so sometimes informatics are broken off from out of IT. There's a lot of nursing informatics programs. There's a lot of different types of programs that sort of teach that. Some programs teach it under the IT schools, and kind of, make it about how to configure the EHR or how to configure different types of systems. So the way that I view it is kind of that way. The key is that informatics, technology, healthcare technology resources, analytics folks, analysts, all these different roles are key parts of this sort of healthcare IT ecosystem that, everybody sort of, needs all these competencies in order to be successful. And so, I know it's not a clear answer, but it's something that, many times I've seen it be outside the informatics group, be outside of IT, so it's maybe under a training program, under a nursing training program in a hospital. And it's really kind of follows that path. But more and more, I've been seeing it converge with IT, because using that competency in IT, understanding the workflows, the terminology, the lingo from a nursing perspective, and tying that with the technology is really the happy marriage. So
This is interesting. And I tell you what, how I look at informatics is the the clinical application layer in a hospital. That's how I kind of look at that. And the IT. A lot of times I'm working with hardware layer, the compute storage
yeah,
layer, and then you're working into, all right, now we've got this behemoth that might be an Epic, or it could be a Cerner, and that type of thing. Now, here's my question. And correct me if I'm wrong, but I think you made the name for yourself where you start to see that trajectory as far as your mastery in clinical informatics was in that you understood these EHR systems and these workflows. And that did that help you to move forward in your career?
absolutely. Absolutely. I can tell you, I started in the Department of Anesthesiology. And when I started there, I started as a data entry person first, just putting data into a database, putting billing anesthesia billing into a database. Then it morphed into more of a data, data analytics. So like, hey, how can we report the data out of here? And then from there, it morphed into how do I support this system that we're capturing anesthesia information to? So more about information systems. And as I work and I developed my skill sets there, at the University of Miami, I ended up moving to the actual IT department. So out of the clinical anesthesia department to sort of the central IT department. And then there I learned the technical skill sets. I learned more of the technical skill sets. I learned the networking. I learned, more about security and the servers and the data center. And so it's almost like I started backwards. A lot of times IT folks start on the hardware side and move to the system side. I started on the system side, moved to the hardware side, and then moved back to the system side, because I felt like using all that skill set, can really help connect the dots, can really help bridge those gaps. And, but many times folks find a passion on one side or the other, and that's okay too. But, I think being able to connect those dots and being able to, align your clinical or business requirements with the system, and then being able to translate that into the technical requirements, served me well. And I think, it's something that I try to pass down to my folks and try to educate, folks on, because I think it's important. The more we understand the whole sort of widget, the better the better stewards we'll be of it, you know?
Well, I think you touched on some really good points, and I know we had talked in the past about these analysts that are coming out of college and that they're needed, and you just stated why you started in that kind of analyst role and how it taught you and how it brought you forward. I think that's phenomenal, because as you get further up, you're in that C-suite level. And at that level, the conversation changes. You're not doing the technical work as much, and maybe not doing as much as all the managerial work, but now you're in that world. We talk about initiatives. You have to understand finance. You have to understand the operations and all those other things that are outside of IT, but IT touches all these things. Help us frame that conversation, how you made that adjustment and your focus and add it to your tool sets.
Yeah, it's it's an interesting sort of transition. I think, if I could start what we as leaders sometimes do with our resources is we get the person that's the best at a particular task or competency, and we immediately want to move them into leadership. It's like, you're the best analyst, I'm going to make you a manager. And sometimes that works out because that resource maybe has dispositions or desires to become a manager or go into management. But sometimes it's not the right choice. Sometimes it's about us putting, it's about us helping our resources grow. And if that's within a subject matter expertise, that should be the way they go. If they want to go into management, which requires different competencies, as we all know, and different, desires and patience, it's a sort of a different track. And so, I've, I spent a lot of time trying to put people in the best positions to succeed. And sometimes that is reevaluating the positions that they're at and trying to align it best to the business. For myself personally, as I've grown through the ranks, I never really had a targeted goal of saying, I want to be a chief or a vice president. That was never really my driver. My driver was, I wanted to impact change. I wanted to, make a difference. And that's really what kind of drove me down the leadership path. And many times I was, edged along by some of these mentors, whether it's Liz or others along the way. And I think that, going down that leadership path made me, I didn't know what I was doing when I first started on that path. And I tried to follow some very simple rule of thumbs. It's like, manage people how you want to be managed, right? Treat them with respect and treat them fairly. And those were the kind of the tenets that I sort of followed, and they served me well. I still kind of apply those today. And I think it's something that, it's a craft like anything else. You've got to work on it. You got to always want to get better. There's always things that I can improve on. And so that's how I try to approach it, is try to take it as constant education and learning and get better at it and pass that information, pass that knowledge down to the folks that we work with.
I like that. I like the answer. And I want to spin the dial a little bit, change the narrative just a little bit here, because you were working with very large institutions, University of Miami, Jackson Health System, Memorial Health System. Then you made a transition. You went to Health Choice Network, which now this is a total different model. This is a national model in scope. You're implementing new technology. There's a different patient mix, it's just a different world. And then you're the Chief Innovation and Digital Officer, CDO. How has that challenged you?
Oh man, it's definitely challenged me. I never, what attracted me about Health Choice Network was really, they're a very mission-driven organization. And, Memorial and a lot of the other places I worked too. But, this was an organization that was really serving the underserved and the unfunded populations in our community and in communities throughout the country. And what they were trying to do really attracted me because I felt like I had a unique set of skill sets that I can help them achieve what they were trying to do, which was, implement Epic to FQHCs throughout the country. And so that's something that really attracted me. I felt like I can provide value to this group, and it's a really great group of leaders. The other thing that attracted me to it was the organization was a little smaller in the sense that, a little flatter from from a leadership perspective. As you work in these bigger organizations, and I loved everywhere that I've worked and I appreciate them tremendously, but there's a lot of layers, right? If you want to impact change, it has to go through, several layers of leadership. And that's okay. I mean, when you're a big ship like that, you have to put those controls and governance in place. Since Health Choice Network was a little smaller, I think, it's just directly to the CEO. We need to impact change. We can change. It's like a smaller speedboat versus a large ship that has to sort of, make the turns. And so, it's funny, prior to Health Choice Network, and even prior to some of the local health systems that I worked at here, I also did some consulting around the country. And I worked a lot at MD Anderson in Houston, the cancer center. I worked a lot in Emory in Atlanta. And, one of the things that I learned and I appreciated so much from that experience was just realizing that the more you go around the country, everybody has the same problems. Every organizations have similar problems. And, we're all trying to solve for similar things, right? We're trying to solve for resources. We're trying to reduce expenses. We're trying to solve the same IT challenges. And so that gave me, I think, the perspective and the confidence to continue to bring that here locally. And then at Health Choice Network, I think it's been the amalgamation of all those years of experience and working across all these large healthcare systems. Now working at Health Choice Network, where again, we're a network of FQHCs throughout the country. And that poses different challenges. There's different state regulations, even though they don't have a hospital, it's a lot of ambulatory clinics. It poses a lot of different challenges because, every state Medicaid laws are different and time shifts, time differentials. So it's a lot of different things. But yeah, no, I've been very happy at, been proud of the work we've done thus far here. There's still a lot more work to be done, but that transition, it took me a little bit to kind of, get some of the lingo and understand some of the nuances of FQHCs. But I think we're hitting our stride now, and we're getting ready to roll out our second big group of clinics throughout the country.
Man, that's wonderful. I think right now we are going through a transformation in our country when it comes to healthcare delivery. I think COVID-19 shed a light on a lot of gaps in the delivery system, and that we saw that technology was a good tool to help us when we were struggling as a society with such a type of disease. So, your telehealth, remote patient monitoring, things that we're going to have to do because we have another tsunami that's coming, the silver tsunami, right? And as that silver tsunami really, really takes over, what am I talking about? It's our elderly population. We have the oldest population ever in the United States, that we have most people are now 50, 60 and above. And there's more of them than there are young people, so that how are we going to care for this population? So we're looking at innovations, right? So here's my question I want to ask you, and I want you to almost even put it on your consultant hat when you think about this, because this is something that we need to do more of. And we volunteer. We are volunteers for HIMSS. We both are part of HIMSS South Florida. You've been a past president. I'm the program chair. But if you, anywhere in the country, could go to a convention, a seminar that is going to help you in your particular work and what you're doing, what topic or topics would be top of mind for you that would say, yes, I need to be a part of that? This episode is brought to you by 5-Star BDM. 5-Star BDM is a professional consulting and advisory group keenly focused on business development services for small to mid-sized businesses and entrepreneurs. Although every business is unique, they often share challenges that can be addressed through smart branding. Services include process improvement in operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our 5-Star business and personal branding company has helped a number of professionals and organizations to optimize and grow. The result is more business, more opportunities, better reach, positive outcomes. Please visit www.5starbdm.com to learn more and view all the episodes of Follow the Brand.
It's a good question. I know we've talked about this one before, but, I think managing a remote workforce, I think is universal right now. And the challenges and the pros and the challenges with how to manage that well, manage it efficiently. I think COVID forced us, right?
Yeah.
Many skeptics of, working remote, it's not going to be as productive. We're not going to this, we're not going to that. But I think COVID forced everybody to, and now that everybody's kind of tasted it and seen that it can be as productive, sometimes even more productive, because you cut out commute, you cut out a lot of, buffer time that gets spent doing other stuff. But now it comes with different challenges. You can't just go around, not that there's water coolers anymore, but you can't just go, stop somebody in the middle of the hallway and just be like, hey, how was your day? Right? So now it's more targeted and more specific, and you have to be more, just more planned for these sort of interactions that used to just be able to happen naturally. And then how do you prevent people from, getting two jobs when they're remote? We've seen some of that. How do you ensure that, you're keeping them in the culture, embedding them in your culture? What is the culture now if it's all remote, right? So all those questions, I would love to have a panel on that, a discussion on that with experts, people who are doing it well, people who are struggling, because I think that everybody's kind of going through that right now. You're even if you don't believe in remote work, you're having to do it because your competitors are doing it, and you're having to do it and do it well. And I think it's a good thing. I think expanding your pool of skills and resources, not limited by that brick and mortar, I think is good, but it does have its challenges, and it's something that I think we're all still maturing and working through. And so that would be something for sure that I'd jump right away.
Yeah.
I know it's not necessarily healthcare IT specific, but
but that is affecting the workforce. All those things are, especially your workforce that's spread out geographically, right? And then you might not even meet them physically. Maybe they've never met you physically. So you've got to now change management style, right?
Yep.
And like you're just saying, how do you gain trust and commitment in a remote atmosphere? And what are you doing? You got to change. So this is a time of change, time of transformation. We hear about digital transformation in the healthcare system. Those are big buzzwords, digital transformation. But there's a lot. It's not just techie, right?
Yeah.
There's a lot of people, because you've got shortages, you've got labor shortages, you've got all these different things that are happening. And then one thing that we talked about during one of our board meetings was analysts. You need analysts. We need more people in the healthcare field studying the health informatics, basically, and coming out of college. Can you just give us some words of wisdom around that? What's happening in that world?
Yeah, no, that's another good topic. I know I've spoken to Stephen, our chair on education, and students at South Florida HIMSS a little bit about this. And I think we have to do a better job as healthcare IT leaders in partnering with the universities and helping drive the curriculum and the programs and the lingo of what, the next future, students coming out of those schools are, and what we as healthcare IT leaders need. So, there's all these great programs that many universities are coming up with and, generating great talent, but sometimes it doesn't align well to what the healthcare IT market is looking for or is in demand. And so, simple things like a programmer, and I don't want to say simple, it's hard to become a programmer, but something that's very clear and fundamental, like a developer or programmer, you're looking for specific skill sets on what type of programming languages they have and certain things like that. I think on the analyst side or the informatics side, you started this earlier, you were asking me to define it. I can define it one way, you can define it another way, the schools can define it another way, the organizations can define it another way. So we do have to come up with a common language of what that really means and make sure that everybody's speaking the same language. But us aligning to what we need as organizations and helping align the universities to create and generate that talent base is critical. For example, analysts is a good one. So a lot of times organizations have the technologists, right? The network engineers, server engineers, the techies. And then on the application side, they're looking for a clinical analyst or a business analyst, and that word has gone through many, many different definitions. But in the definition of today, if you go to Memorial, if you go to Jackson, if you go to UM, if you go to Health Choice Network, what that really means is somebody either certified in Epic or certified in Cerner, if we're looking on the clinical side. If you're looking at it on the business side, somebody that knows Workday, that knows ERPs, right? It doesn't have to be vendor specific, but, solution specific, or understanding that there's going to be configuration of systems and the right competencies around that. So yeah, I think it's a challenge. It's something that I think it's incumbent upon us as healthcare leaders to work with our university partners and help align these programs out. I think they've done a great job with like security programs. I think they've matured well on that. I think data analytics, so like, reporting and, data mining and data analytics from the back end perspective, I think they've done a good job with that. I think on the application side or the information system side, they haven't done as good a job aligning for that. I think because a lot of times they tie it to informatics, but informatics is getting there, but it's still not all the way there when it comes to aligning to some of the needs of, because an organization like a big hospital system, I think, informatics, that's not an analyst. That's somebody that's going to go into nursing and help with workflows and training. Mm-hmm. But the student or the school might think, I'm trying to give you analyst, and it's not aligned, right? So, so I think that's, it's a big, I think it requires getting some good minds together and whiteboarding and troubleshooting and then getting the schools in alignment, because I think there's a mismatch there, and those positions are in high demand. Those are the ones that we're hiring across the country, and sometimes we're not finding the people with the right competency.
And you nailed it right there. That is something that you're going to school, you get an indication, you're coming out, you have a certain skill set, but then on the employer side, that is not the skill set that really fills the gap that you need. So we definitely need to first have the conversation around it like we just had. Let's talk about it, because I think you can make some fixes, but we have to have communication. The hospital system, the healthcare systems need to be talking to the colleges and let them know this is what's important now, because the digital delivery, the healthcare delivery system is changing. It's changing rapidly, right? So your digital front doors, your the internal workflows, the external patient experiences, all these things are in rapid change. Everybody's speed to market. Everybody knows that healthcare is a gigantic elephant, that's moving at light speed. And so how do we then get a hold of it before it gets out of control? So I like your conversations. And one thing, we'll talk about HIMSS, if you've got a chance. That's one thing we try to do at the association, as Health Informatics Management System Society. That is what it's all about. I think we're fortunate in our chapter because we have universities as part of our chapter board. So we get an opportunity. We have a lot of events like at Nova Southeastern University. We're going to have an event here coming up at FIU. And we want to continue to have these kinds of discussions. We could be at the University of Miami. We've got to bring our community together. So we've got good people, they're bright people, that they're trained the right way, and they can get fulfillment in their career in what they're doing. So you don't have to they got out, they just did 4 years of education, then I got to now train them for the next 2 years, even before I can get any kind of value out of that. No fault of their own, but it's just I need you to be able to operate in my environment. And that's you don't want to create a bottleneck at that point, right?
Yeah, no, it's very true. It's very true. I see some really bright people coming out of schools, and it's hard. It's hard sometimes to get them into a job. And sometimes when you are getting them in, you're getting them into an entry level position that is not even aligned to what they went to school for, which, at least they're getting the foot in the door. But yeah, I think we have to do a better job of aligning that. And, it's up to us to make the change for sure.
So I'm going to ask you one question, one last question. Well, you've been great. You've been wonderful. And this is around branding, because we're on the Follow Brand Show. And branding is about, I do it a lot with personal branding. And if you were not in the room, you're not in the room, right? And there was a group of people, and I'm talking about some of your mentors, some of your reports, some of the board members, and they're in the room, they're talking about Oscar Perez. What do you think they would say?
Oh, wow. Is it that funny bald guy with a beard? No, I'm kidding. No, I think they would, I would hope that they would say that, Oscar's he's a leader that's always trying to do what's right. He's a humble guy, but funny guy that really really just wants to do the right thing and has a passion for what he does. Because I really do feel fortunate in life to have found my passion. I don't consider it a job. I don't consider it even a career. I love what I do. I do it at day and night, in the mornings, and I try to get folks to find that passion as well. Sometimes it's within our reach, and sometimes it's maybe a different path. But I think if you find that, like I think you found your passion here doing these podcasts, man. You do a great job of it, and I think that. So that's I would hope that they say that that Oscar just was an even keel guy that tried to do the right thing and tried to improve healthcare, and hopefully leaves it better than he found it. So.
Well, I tell you, I asked that question. I went out and I asked as many as people as I could that knew me and knew you, and I said, "What do you think about Oscar?" And the words I got back. First of all, trusted leader was big, approachable, was huge, kind. Was another big one that came up. But the biggest one that came out that was they liked a lot was he is a bright light in our healthcare community. I think that says a lot, about you. When others will say that about you, that you are that light, that you've been helpful, that you have solved some problems, that you've been impactful in the healthcare delivery. You when you needed to say something needed to be changed, you would stand up. You had enough, guts to say, what, that's really probably not the direction we need to go in, and here's why. So people do have a lot of respect for you, and I appreciate that. And then before I let you go, is there any last words you like to state? Anything we've missed, anything that you're itching to say? This is your time. I'm going to give you the mic.
Oh, always putting me on the spot, on Grant. No, I mean, I just, I appreciate the time, Grant. I think that I've known you for a long time, and I think that, you were also, I think, a beacon of hope in our community, in our industry. And I think that we need more people like you, going out there, telling our story, telling them what we do. We are, I think, the pioneers of change. Healthcare. I've always said that healthcare is one of those laggard industries. It's always lagging behind finance, lagging behind this. And I think one of my drivers has always been, well, let's get it to be a leader. And I think it takes people in order to do that. It takes good people with no agendas and trying to do the right thing. And I think you're one of those as well. So I appreciate you, and I appreciate you giving us a platform to be able to talk about some of these things. And we still got a lot of work to do. At the end of the day, we still got a lot of work to do. And but I'm excited to be doing it with people like you and some of our peers. So I appreciate it.
Well, likewise, my friend. We do have a lot of work, and acknowledging the work that needs to be done and then celebrating our successes is big. And I definitely want everybody to come out for Integrate. We'll have South Florida HIMSS. We'll have Integrate 22. That'll be November 16th and 17th. 17th will be the major seminar at Nova Southeastern University at the Innovation Center, the brand new Innovation Center. So we're looking forward to that. And we're going to have great conversation. We're talking about how can we solve problems by coming together, right? So we're gonna celebrate, but we're gonna have discussions around healthcare delivery with technology insights. That's what it's all about. So, Oscar, if the audience would like to get in touch with you, what is the best way?
You can contact me via email, operez@hcnetwork.org. You can always text me or call me at 305-321-0132. Just don't spam me, but let me know who you are ahead of time. But no, yeah, I try to make myself available and accessible. So anytime, feel free to reach out to me.
Excellent. I'm glad you said that, because if people that want to reach out to you have something meaningful to talk about.
Yeah.
Let's have meaningful conversations. That's how we move the ball forward for everybody, and we all benefit. So if everybody wants to contact me, go to www.5starbdm, and that is B for brand, D for development, informasters.com. Till next time. Thanks a lot, Oscar.
Thank you, Grant. Thank you all.